Alright, let's talk about something we all dread, cold sores. Also known as fever blisters, these pesky sores are caused by the Herpes Simplex Virus Type 1 or HSV1. Now don't freak out, HSV1 is super common and affects a lot of people worldwide. So let's dive into what causes them, how to prevent them, and what you can do if you get one. First off, how do you get HSV1? It's primarily transmitted through direct skin-to-skin contact like kissing or sharing utensils, lip balms, or towels. Even sharing a drink or straw can do the trick. And if you touch a cold sore and then touch other parts of your body, you can spread it to those areas too. In some cases, oral genital contact can also transmit HSV1, causing genital herpes. Once you're infected, HSV1 stays in your nerve cells and can reactivate under certain conditions. So, what can trigger a cold sore? Things like fever, a cold, stress, a weakened immune system, sun exposure, hormonal changes, or even a facial injury. The virus can stay dormant for months or even years, but these factors can wake it up. Now let's talk symptoms. Cold sores progress through several stages. First, you get that tingling or burning sensation before the sore appears. Next, small, fluid-filled blisters pop up, usually at the border of your lips. These blisters then burst, leading to painful sores that eventually dry out and form a crust. Finally, the sores heal without scarring in about 7-10 days. Diagnosis is usually straightforward and based on symptoms, but if needed, doctors can run tests like PCR or viral culture to confirm it's HSV1. So, how do you treat cold sores? While there's no permanent cure, you can manage the symptoms. Antiviral medications like topical creams or oral antivirals can reduce the severity and duration of outbreaks. If you get frequent outbreaks, long-term antiviral therapy might be recommended. For symptomatic treatment, pain relievers like paracetamol or ibuprofen, moisturizers, lip balms, and cold compresses can help. Prevention is key. Avoid close contact with people who have active lesions and don't share personal items like razors or towels. Practice good hand hygiene after touching your face, and use sun protection like lip balms with SPF to prevent UV-triggered outbreaks. Managing stress and strengthening your immune system through a healthy diet, exercise, and adequate sleep can also help. Remember, herpes simplex is common and manageable. It's not a sign of poor hygiene. Seek medical advice if your outbreaks are frequent or severe. By spreading awareness and educating ourselves about herpes simplex infections of the lips, we can reduce stigma, promote early treatment, and encourage responsible prevention strategies. Thanks for watching. Stay informed, stay healthy.